Hi, this is Dr. Spahr for the Hormone Balance Center. One of the things that you may be aware of in recent years is the conversation surrounding vitamin D. Vitamin D has many aspects in the body, but oftentimes we find that we have low vitamin D, particularly if you are in an area like Indiana, Illinois, Michigan, so on, because the sun, as you know, is rarely in the sky very much longer after August, the end of August, until we get around to April and May. And when it happens then, the angle of the sun going through the atmosphere is not quite enough for the ultraviolet lights to hit your skin and convert to vitamin D. Also, vitamin D can be blocked from changes into the skin by ultraviolet rays with the use of sunscreen. So by using sunscreen when you go out initially, it can be somewhat protective for your skin, but you're also going to prevent you from actually developing the vitamin D you may need. So many times around 5,000 units of vitamin D is very much needed to get your levels back to where it needs to be in most adults. Looking at the charts for vitamin D and its levels in the bloodstream, you'll find that as we look here at the serum level in this upper left-hand corner here, that we'll find that rickets, in other words, the prevention of bone development, really occurs quite nicely, 99% reduction in the levels less than 20. So really, most people do very well from the standpoint of rickets in this range. But you don't start getting into the real important aspects until you get up around into the 30s and really into the 40s, 50s, 60s, and on up. So for example, breast carcinoma, breast cancer, between 30 all the way up to the low 50s, and that helps to go ahead and prevent breast cancer. You'll find that things like colon cancer also is in the 30s up to the 40s and 45s. Diabetes, you'll see that also, the prevention is much better if we go all the way up here into the 50s as well. So you see all these things really kind of come into this arena. Multiple sclerosis, you'll get a 33% reduction here at about 42. But when you get up into higher levels of high 40s, and now you're going to get a 56, 54 reduction of multiple sclerosis. Kidney carcinoma as well. Heart attacks in men also is done at up to 50% when you get a vitamin D level in the upper to mid 30s. So keeping your vitamin D really at a baseline of 30 to 40, that's about the lowest you want to be. Optimized, you want to get up to the 60s. In summary, at the Hormone Balance Center, we want to look at biochemistry and the optimal biochemistry for your body. What that means is we want to have your levels at a bare minimum of 45. I really want to push that to 55 or 60 if we can. And some people can go all the way to 80. That is going to assure us of having the best ability for you to build bone. It's going to also give us the ability to go and reduce all different types of cancers. Also heart disease, multiple sclerosis, and many other illnesses and diseases. And one other thing is that vitamin D is also important in how you handle your hormones. So please get your vitamin D checked and then make sure you're taking the right amount, and then check your levels once you start the vitamin D to make sure you're falling within the 60 to 80 nanogram per deciliter. Thank you very much. Have a great day.